Chair. I'm a fast talker. Minister, I think there's few bills like this one have come before the Oireachtas in our time here in the past 10 years, and I do have to genuinely say to you it is a difficult bill to support because it is dividing society and it is excluding, and that's obvious and I think accepted by everybody, and it's not something that anybody or any government would do lightly. And actually, even in some parts, it's going against NPHET's advice, which is not something that we have done since before Christmas, and we don't do that lightly. But I do appreciate the dilemma the government is facing between securing the livelihoods of tens of thousands of people who are going back to work in the next couple of weeks, and an industry that supports Ireland that we rely on so heavily. So I will be supporting this bill today, but I do have to say it is qualified support, because I think we all absolutely must see, with the sense of urgency that we haven't seen to date, an implementation plan on the introduction of screening of antigen tests into hospitality, into transport, into all of the aspects of life that we haven't seen or people haven't been able to access for the last 16 months. And I think we need to see it in and around the same time as we expect our restaurants and our pubs and stuff to open on the 26th of July. And I have to be honest with you, we've seen so much flapping around with regard to antigen for months now. We've had illogical resistance. We've had insults to the Irish people's intelligence that we couldn't possibly use them. And all the while the HSE were using antigen tests to make sure their own staff were returning to work safely. So I really do believe that we've enjoyed social cohesion in this country in the main over the course of the pandemic. But we're at a point now where we're really testing people's patience with this law. And if we don't provide the mechanism to allow the people that are being excluded by this law to partake in Irish society, we're at risk of losing that social cohesion and that solidarity that we have enjoyed for the last 16 months. And I also have to mention that how including the children of vaccinated adults into this law does allow families to make decisions for themselves, and that's probably maybe to be welcomed. But the inconsistency of the messaging between government and our CMO is absolutely jarring. We've government saying it's okay for the kids to go for their burger and chips indoors with their mammies and their daddies, but we've government and the CMO saying it's not advisable and I wouldn't do it if I was you. But at the same time, we're telling our kids that they can't have indoor summer camps, which we all know they need for their mental health and their well-being. But in 6 weeks' time, we're going to tell all of our parents that it's safe for our children to go back to school. So which is it? Like, there has to be consistency in our messaging, and I'm really sorry to say that that's something that hasn't been employed for the last couple of months. I want to just finish by saying that this is emergency legislation, which is why we're doing all stages of it together today. But it's emergency legislation to allow people to eat and drink inside. And the irony here is that we still have women up and down the length and breadth of this country who are giving birth to their children on their own, and in some cases losing their babies on their own. And I have to really tell you that that says an awful lot about our priorities.
Thank you very much indeed.